Would you like a second opinion on your diagnosis? Please send your analysis and medical history to visit@qs24.tv and our Chief of Medicine, Dr. Wiechel, will analyse them for free and anonymous in our new series Ward Round. For more information, visit www.qs24.tv.
Hello and a warm welcome to today's episode of Ward Round.
I had the pleasure to read all your precious questions and was able to choose two, and would like to talk about the subject of excessive urination. This urination has not been described by the patient from Germany as something that is dripping and has a decreased strength of the urethral sphincter. But the way I understood it, she has to go to the toilet very often at night. Unfortunately, now we just have the question ahead. What can be done? However, this should not be the question. Instead, we first have to ask or get some hints. What has happened to you in the course of your life? The first thing I think of when someone talks about excessive urination at night is that they drink too much in the evening. And that's why they can't find peace and quiet. Also, the kidneys prefer not to work at night, while the liver works from midnight to 3 a.m. The kidneys are quite thankful to rest at night and continue to work in the morning. If you drink too much in the evening, because you realised you didn't drink much during the day, then it's your body's normal conclusion that you have to drink, because its duty is to detoxify through the kidneys. That's the first thing. The second thing is that the kidneys and bladder are connected to the regulative strength of the bladder-kidney meridian. And if women have a scar in the area of the abdomen, for example, after an ectopic pregnancy or after a caesarean, or after an appendectomy, so the treatment of appendicitis or hernias, then these scars could also be so-called interference fields. Even breast surgeries, now that I think of it. Everywhere where there are scars that are in this area along the stomach. In 99% of the cases, a scar normally looks quite harmless if it did not develop a big keloid and is raised. Then we would not even ask about it. But if the meridian flow, we also call it the energy flow, is weakened by the scars, then the organ, or the organs, or all the functions we have along these meridians, which is a thinking, practice and experience as a part of the Chinese medicine, and more than 5,000 years old, have a different impact. Maybe I can give you an example. I learned about the meaning of scars when I was a young doctor. I had a patient that had pain in the shoulder. He has had this pain in the shoulder for 4 years. They did an arthroscopy and endoscopy. First it said that it was calcified, then it was a stiff shoulder, then it was the ligaments. He got surgeries and this and that. And he kept taking painkillers and therefore couldn't sleep at night. And I didn't treat his shoulder. I'm not a specialist for shoulders. But I looked at him, and when he got undressed, I saw a bypass scar. So I asked him, how long ago was the bypass? And he said 4.5 years ago. And there the pennies started to drop. And back then I couldn't do the tests that I can do now. Today I can test the scar, if it has an interference field or not. I wasn't able to do that yet, so I just gave an injection beneath the scar. And the patient called me the next morning at 7 a.m. and asked, what did you do? And I said, well, what I did do, I injected beneath the scar. Yes, he said, for the first time in 4 years, I slept like a log. And I can move my arm, and I don't need any painkillers. I saw this patient 3 more times. He didn't live in my area, and then not anymore. After 3 or 4 years, he came back with his wife and pushed her here. And I said, you are the gentleman with the painful shoulder. Yes, but since you have given me the injection, I have not had any more pain. It is not often. Those wonderful, Honecker calls them the second phenomena, when within 24 hours the process regulates itself. I have not experienced this 1,000 times in this intensity, maybe 4, 5, 6 times. But with every scar treatment that I have done, I help the process to improve. It is all part of a treatment. A treatment is not just giving a drug and everything is fine. Treating also means handling and understanding a process and how it can arise. These are all the things that need handling. And I experienced so many things caused by interference fields. Those interference fields are normally distant to the symptom. And if you understand the causality of the kidney and bladder meridian, then you will first have to look there. And I would ask you to check yourself and get the scar interference fields checked. And also the interference fields up here, which could also be chronic sinusitis, but could also be the front teeth, the 4 teeth up here, and the lower 4 teeth. And if the front teeth are dead, avital, if there is a pivot tooth, if there is a dead tooth, then the consequence would be, or could be, a long-term interference of the bladder meridian or the kidney meridian. You could imagine it as follows. If you have a room full of 10 lamps, then you could work 24/7 with these lamps, because the room is light and you have the possibility to work efficiently. Well, not 24/7, because at night we need melatonin, and for that we need darkness. But just for the visual understanding. Now, it could be that the power station supplies less energy. There is a defect, and it just supplies 30%. Then the output of the lamps for me will also be down to 30%, which means I have to adapt to less. So, if it's winter, and gets dark at 4 or 4:30 p.m, the room is dark, and I can expect less output out of my body, because I can hardly read. That is the same in our body if an interference field is blocking a meridian flow, an energy flow. It's all about that. Only about that. If something becomes sick, there is too little energy present. The energy has to flow where it is needed. And if less energy arrives, the output will decrease. That means the bladder might not have the capacity, not the holding capacity anymore, and is causing this excessive urination. That is also a very important point, which prevents you from sleeping at night. Please also think about bacterial infections. There could also be a bacterial cystitis. Please also think about the bowel. We have talked about the leaky gut syndrome before. When the bowel has a penetrability, you can find coli in the urine, and the body has to fight coli bacteria. You can prevent coli bacteria from sticking to the bladder wall through manosa, but this would have to be ruled out. And then a urine culture can be made, and maybe you should collect sterile urine. Well, it's never sterile, but a culture means it has to be collected in a sterile tube. So maybe collect it in a sterile tube, 3 samples in the night, to check if that could be the problem. And at night, the liver is in the state of detoxifying, and maybe there are things that shifted to the night rather than the day. If the liver is getting weaker in detoxifying, then my kidneys have to work harder. In our body, it is not like it is in society. You help me, I help you. It's a giving and taking. It's different in the body. One organ is preparing for the other one. And we have to understand why these things got out of balance. That could be due to interference fields, scars, chronic sinusitis. Maybe you don't know about it yet. It could be the interference fields of the teeth. Please also don't forget we have another scar, our belly button. The belly button is not along our kidney and bladder meridian, but along the big conception vessel, which also has an effect on the functionality of the bladder. And even deep injections in the belly button, 5 to 10 millimeters, could calm irritations of the interference fields. There is a society for neural therapy in Germany as well as in Switzerland. As part of this society, you can check a list of therapists with your zip code and see who is close to you. Every doctor trained in neural therapy knows about the connection between interference fields of scars and the burden on another level. There are also many parasites. I always come back to the subject of parasites, but I'm just so thankful that I have learned more about it in recent years. Because if I reach my limits, I look for something else. And I was able to, and I could settle essential things, since I know how to test for parasites and can eliminate them from the body. Please keep in mind that for everything, parasitic, bacterial, the body is made from bacteria, a lot more than body cells that do the work for us. And if it was all about a higher development, due to a shift in the milieu, that's how it's called, which means the milieu is not in the bladder anymore where it should be. The milieu in the small intestine changes, or in the large intestine. This will cause pathological bacteria, and the body tries to discharge these bacteria. Sometimes they are not taken in from the outside, but due to a dysregulation process in the milieu of the body. And it is interesting to understand we are talking about the so-called pleomorphism by Enderlein. That means that the microorganisms in us are responsible for life for all procedures. But when we change the milieu through hyperacidity, through stress, through many things, then these microorganisms change to other phases. The next one is the pathology of bacteria, which will then need to be destroyed, causing an inflammation or infection. And the highest one is the fungi. Since I have understood that as a young doctor, I was able to stop treating children with antibiotics. If you understand the cycle, then the antibiotic, which is always against life, only needs to be used when the other methods reach their limits. That, I think, would be my answer to this question. This is probably a lot more than would have to be checked, but every journey in the right direction starts with the first step. And maybe you could already take some precious information from this. Great. I wish you first of all to sleep well, because even if we talk about sleep hygiene very little, it is extremely important to give our body enough time to rest. I have a second question of a patient who told me that she's been eating vegan for a while and is sad that she is still gaining weight. Maybe the reason was to reduce weight. Eating vegan is a diet that we choose either for ethical reasons, for reasons of consciousness, and there has been a great development also thinking about the publications about a vegan diet. However, if you want to eat vegan, you have to do it right. I also didn't used to have the knowledge I have now and did it differently. Apart from that, there are also phases in which we are vegetarian, in which we don't eat meat or fish for a few years. And then I can often see it with patients that they are leaning towards eating lots of carbohydrates, lots of fructose. So more fruits, more vegetables, more grains, and that, on the other hand, can stop the weight reduction very, very drastically. Because everything with fructose, glucose, carbohydrates, also rice and potatoes, causes sugar to appear in the blood. And this sugar is available to our body. It has to work with it. The art of a diet is to reach a high quality. I think you all realize that whenever I talk about food, I mean high quality. 5 apples from an organic produce shop are 1,000 times better than a kilogram from the supermarket, which has been sprayed with pesticides. We also don't need big quantities of everything. The quality is important. And if you don't balance a vegan, meatless and possibly protein-reduced diet well, then the dominance of sugar can cause weight gain. And this dominance is something that the body doesn't need because it is not challenged that much. So the sugar gets to the liver, and the liver can only convert the sugar either by converting it itself or by putting the excess sugar as fat onto the hips. There is no other way, unless you would do a lot of exercise every day to use this sugar directly in the muscle metabolism. That is one thing you should keep in mind. The other thing that I see is in the protein metabolism. If you eat vegan, you'll also eat quinoa. You will eat lentils, all high-quality proteins. But these proteins will have to be broken down. And for this, you need enough enzymes in the small intestine. One thing is that this protein breakdown results in the appearance of amino acids, which are protein bases. And only with these amino acids, with the body or the liver respectively, is able to build the 22 proteins it needs every day. There are 8 essential amino acids, and with that, the 22 proteins can be built. That means there won't be an immune cell, no protein, no iron, no B vitamins can be transported, no fats can be transported if there is not enough protein structure. That's why proteins are also called the building blocks of life. First of all, you need proteins and natural minerals, and the rest is going along with this process. On the other hand, resulting from part of this, protein metabolism, is another metabolism which is building energy. That means on this sideway, the result is to build enough energy for our body, and this has a byproduct, which is ammonia. And I can see it often in patients who eat vegan, that they may have a disharmony on the bowel, while the small intestine has a pH value of 8.5. The large intestine needs a pH value of 5.5 to 6.5. If you don't have this pH value, the ammonia can't be discharged. This means there is too much ammonia. Ammonia is a serious toxin. I often ask myself why there are more tumours in the small intestine when there are only few in the large intestine, and the ammonia gets through the mucus to the liver and can react negatively with the liver metabolism, which is the most important metabolism. And as part of the fat and insulin metabolism, you should also know this. What is the connection with protein and ammonia, and especially the intestinal flora? Please also don't underestimate that weight gain can be connected to a direct metabolic decompensation by not producing enough thyroid hormones. Maybe this has been tested already. I don't know. But I only see only one collection and possibly only TSH. But also the free hormones and the T3 reserves have to be tested. We also have to check if the body has enough L-tyrosine. And we're back to the proteins, amino acids. Is there enough iodine? Maybe this is a latent dysthyriosis, which we don't know in academic medicine. We only know hypo and we know hyper, and if we don't recognise this from one value and everything is balanced, a thyroid disorder is off the table. But you would have to go deeper into the diagnosis and look at the whole clinical picture. And I always want to know this from my patients. Sometimes the thyroid hormones have to be checked 3 times a day, the same as when we check the adrenal glands and see how do the adrenal glands work. Yes, we need saliva of 5 different times a day to see how they start and how they finish at night. That is something important that we should also know about the thyroid. Because if the thyroid metabolism decreases, at 100% we are active and healthy, and now it's only at 85, then the metabolic output is less, and that can also have an effect on the regulation of the sugar metabolism and other processes. Adrenal gland is the last key word. I don't know anything about your life. If you're in a dramatic life situation, your life is stressful, then you should know that your body is the result of your life and has to go through, has to help you, has to work, has to move along, and will produce adrenal gland hormones. And these adrenal gland hormones increase and stay increased even longer than they would have to because they are needed. And as part of this process, including the oversupply of adrenal gland hormones, including cortisone, will make you gain weight with bread and water. You probably know those people with high cortisone levels that gain more fat and muscles in the face and torso, but less in the arms and hands. That might not be the main topic for you, but since more people are listening and also watching, I just wanted to add this too. That means a hormone dysregulation as part of an estrogen dominance. And we can only have an estrogen dominance if I have more estrogen than the counterpart, progesterone, but I can also have too much estrogen when there is too little progesterone. All these things as part of a weight dysfunction that you can't explain are important to check so that you can start to do the right thing, step by step, and also understand yourself better. Why maybe eating vegan at the moment is not the right thing. But first of all, other things have to be changed. Or a diet can be found that suits my needs at the moment better. Or maybe we have a look at life and change a few things in life so that this diet can fit again. These would be the things that I think are important for you to know. So thank you everyone who listened and watched carefully. I'm looking forward to next Sunday. All the best.
Liebe Zuschauerinnen und Zuschauer, die vorangegangene Sendung ist eine Indikation für einen ganzheitlichen medizinischen Ansatz und ersetzt nicht den Gang zu einem Arzt Ihres Vertrauens. Besten Dank.